Hello, I'm Professor Shelley Madigan. Welcome to my short video on medical records in long-term care facilities. Let's get started. There are two types of medical records: electronic medical records, also known as electronic health records, and paper health records, or the patient chart, and the MAR, medical administration record. CMS offers an in-depth video series on many long-term care topics. I encourage you to check it out at cms.gov on your own time. This particular video is a little over an hour long, but well worth it. All medical records should contain patient identifying information such as name, date of birth, room number, allergies, medical diagnosis, medication list, insurance information, prescriptions, power of attorney and family contact information, family history, physician notes, and lab results, among other state or federal forms or organization-specific forms. There are several ways in which patient information can be gathered and therefore documented. Thanks to modern technology like computers and electronic health records, recording patient information is often an easier task. Still, many healthcare organizations use a combination of electronic health records and paper records, so we'll address both. What are some general rules for both types of records? Well, first, there are patient information. All patient information is recorded completely and accurately, and all necessary documents are in the file. I would recommend creating a simple checklist that can be used in all paper files so that items can be checked off and initialed by the intake specialist. 2, all health records are protected patient information, and under HIPAA, they must be protected. This means only the personnel that needs access to the file should have access to the file. We will get more into HIPAA later. And 3, all entries in the medical record must be initialed and dated to allow a chain of custody. There is a saying that they drilled into us time and time again: if you didn't document it, it didn't happen. Think how this might be very bad. What if a patient receives medication, but the nurse forgets to document it? Then the next nurse comes in and thinks the patient hasn't had it, and then overdoses the patient. Serious legal consequences would follow. Document everything to protect your patient and yourself. Medication management in long-term care facilities has its own challenges, especially when it comes to records management. State visits to maintain licensure often involve auditing patient charts. It's a good practice for administrators to review patient charts on a regular basis, like every 2 or 3 months, to make sure they're up to date and complete. According to the NHI, recent studies have estimated that as many as 251,000 people die each year in the U.S. as a result of medical errors, many of them simply documentation errors or missed entries. The solution they determined is better education and training of documentation rules, laws, and ethics. The risk of documentation errors is greater in long-term care facilities because patients are often moved between many different facilities in their course of care. That means greater care needs to be taken to protect patient health, and this starts with solid documentation skills. Long-term care professionals who need access to patient records may include doctors, psychiatrists, nurses, CMNAs, MAs, caregivers, hospice, nurse managers, long-term care managers, and proper state authorities. Otherwise, all patient records are kept confidential and either in a password-protected EHR or a locked room or area. Once patient records are in your custody, they are your responsibility. Thank you.